Let's take you live to Sydney now. We've been waiting for the New South Wales Premier Dominic Perrottet. Here he is. He's making a pretty big announcement about the health workforce, and this is foreshadowing the budget this year.
In relation to how that public sector pay increase occurs in reality. So from currently we have a 2.5% pay increase, which is a baseline pay increase. That will go to 3% in the first financial year, and in the second financial year it will be 3% plus up to 3.5% for any productivity savings. But that obviously is in addition to natural progression that occurs with experience in the public service. So I'll give an example of that today. The salary of a registered nurse or midwife in their fourth year of service will increase from $76,666 to $78,605. And that's as a result of the 3%. Now, when the nurse or midwife progresses over the course of the next 12 months as part of their coming into their fifth year of service, they'll receive an additional $3,905, which is an increase of approximately 5%. So the total increase over the next 12 months will be an increase of 7.6% in relation to their wages, or the equivalent of $5,845. In relation to a teacher, for example, a teacher in their fourth year of service will increase from $87,157 to $89,362 as a result of this increase of 3% in wages. Now, when this teacher over the course of the next 12 months progresses from their fourth year of service into their fifth year of service, they'll receive a further $7,632, which is 9%. On top of the 3% that we're announcing today. So all up, that is an increase to a fifth year teacher's salary of 11.3%. So the announcement we are making today, I believe, is fair and responsible. It balances the competing interests that we have as a state after what we've gone through over the last 2 years, where we've invested record amounts to keep our people safe, to keep people in jobs, and to keep businesses open. There are always competing interests when you are dealing with difficult times, as we have, coming through a 1 in 100 year pandemic. But what we have decided as a government is to continue to invest record amounts in frontline service, to continue to reform, to continue to set up our state for a brighter future for generations to come. And we believe today that the wage policy that we're announcing is fair and responsible. It understands the competing interests of the budget and ensures that as we move forward here in New South Wales after a difficult 2 years, we continue to invest record amounts, as we are seeing today, in our frontline health services. Over 10,000 new appointments, 10,000 more staff for the people of our great state, more nurses, more doctors, more allied health professionals, paramedics, to provide the best health care to everybody right across New South Wales. Those record frontline investments continue. I'm very proud of the fact that this is a government that stewarded our state through the last 2 years of this pandemic, but at the same time, as the Treasurer will continue to announce over the next 2 weeks, a budget that sets up our state for a brighter future and success for generations to come. I'm now going to pass to the Treasurer, who will speak to the announcements today, then the Minister for Regional Health.
Now that's where we leave Dominic Perrottet, a significant announcement for health workers in the state of New South Wales. Health workers given a 3% pay rise from 2.5% this year, and then next year the budget will detail that going up again.